So my name is Chelsea Hopkins. I'm in Professor Anne-Marie Higo's bone pain team at the University of Copenhagen, and I'm currently a postdoc. But a lot of the work that I'll be presenting here was the topic of my four-year PhD studies. Before I go any further, normally we leave acknowledgements until the end, but I'd like to just acknowledge here our key collaborators at NIH, Mike, Alison, and Lewis, because without them, we would still be trying to figure out mouse models. So really, a lot of our success here is due to them. So I'd also like to thank Dr. Boyce and Dr. Brown for yesterday introducing pain in the clinic, because now I don't have to do any of that. But I would like to just take you back to some of the concepts that I'll be talking about, and I want people to understand what I'm talking about so that you're not lost. So firstly is this concept of nociceptive and neuropathic pain in FD. So nociceptive pain in the Spencer paper published last year, of the responders, 45% of those responders reported features of nociceptive pain. And this is resulting from actual or perceived damage of non-neuronal tissue. We also have neuropathic pain. And in the same study of the responses and what they can deduce from responses, around a third of patients reported having this neuropathic-like pain, and this is resulting from damage to neuronal tissue itself. There seems to be evidence of both types in FD patients, but it's very likely that patients experience both at the same time. But it's particularly neuropathic-like pain that has a significant impact on the quality of life, and it's probably also the most difficult for people in the pain field to treat as well. But currently there's no information on mechanisms, and I was reading the pamphlet in the welcome bag that we got, and in the patient priorities list, pain is the #1 priority, and that's what we're trying to do, is investigate mechanisms and also hopefully one day treatments as well. So looking a bit at the nervous system, very simply, we have the brain and the spinal cord, which makes up our central nervous system. Everything outside of that is our peripheral nervous system. And in our central nervous system, not a lot of people would know this, but we have our dorsal root ganglions. These are where the cell bodies of our peripheral nerves sit. So this is what we study in our mouse model as well. And we also look at the spinal cord. So Dr. Zhao just introduced the mouse model that we've been using, and this was developed by him in the McCune laboratory, and very kindly provided to us by our collaborators at NIH. Unfortunately, I can't point here, but we have our FD mice. These are the ones that express the mutated GNAS gene. They also have this site-specific expression, so this is limited only to the bones, and it's an inducible model. So we give them doxycycline in their water, and this induces the expression of the mutated GNAS gene. However, the control mice have all of these other genes that allow for site-specific and inducible expression, but they don't have the mutated GNAS gene. So what did we do with these mice? Well, we took our FD mice and we take our control mice. And here first we did behavioral studies. So first we took male and female mice. And here we just wanted to determine if there was behavioral changes between the FD mice and the control mice. Spoiler alert, we did see some differences. And so in the female mice, we tested common analgesics as an intervention to see if the observed changes were due to a pain-like phenotype rather than something else that may be changing their behavior. For this, we did grid hanging, cage activity, and wheel running, as well as burrowing. After this, we euthanize the mice, and we take their bones, their spinal cords, and their dorsal root ganglia, and we cut them into fine slices and analyze their protein expression to analyze their tissue. Then from other mice that haven't received doxycycline, we take the bone marrow stem cells and we culture these in vitro. From this, we did CAMP assays as well as a multiplex assay. Throughout the course of our behavioral studies, we did X-ray imaging to track the progression of the development of FD. At baseline, this is where they haven't received any doxycycline yet, and in all of the mice in the control and the FD mice, we see this normal skeletal phenotype. For the control mice that also received doxycycline, they do not contain the mutated GNAS gene, and they maintain their normal skeletal phenotype throughout the course of the experiment. However, at day 7, we start to see subtle changes in the calcaneus in the female and male mice, but also in the male mice, we start to see changes in the tibia and the fibula as well. Then, after 14 days on doxycycline, we start to see more progressive changes in the calcaneus, where we also start to see deformity. We also see changes in the tibia and the fibula in both the male and female mice. But also in the male mice, we start to see pathological changes in the femur as well. So the male mice tend to progress a little bit faster than the females, but if we keep the females on doxycycline for a little bit longer, they tend to express the same pathological changes as well. So going on to a bit of behavioral studies now. Grid hanging is a natural behavior. In their cages, they like to hang on their grid and climb all over it, and it's been used in other inflammatory and neuropathic pain models. So simply, we put the mice on a metal grid and we flip it over. We film them for 2.5 minutes, and afterwards we measure the latency to first fall, so how long it takes them to fall to the cage floor. And in the intervention study, we tested 10 milligrams per kilogram of morphine as well as vehicle. So in the male mice, on the y-axis, we have the total grid hanging time up to 150 seconds, our maximum time. The control mice maintain their grid hanging ability throughout the course of the study. However, in the FD male mice, we see significant decline in their grid hanging behavior over the course of the experiment. In the females, we see something very similar. The control females are able to maintain their grid hanging ability, whereas we see a significant decline in their grid hanging ability at day 11 and at day 18. But is this actually pain? Well, we need an analgesic to tell us that. So we saw quite a wide variability in our pre-treatment time points, so we wanted the mice to act as their own control. So we did grid hanging basically in the morning, and there was no treatment. Then in the afternoon, I came back and I gave them either morphine or a vehicle, and I tested them again with grid hanging. So here, because of the differences in baseline at pre-treatment, we took the difference between the treatments. So I simply subtracted the pre-treatment time from the post-treatment time. So here, a value of 0 would mean that there was no difference at pre-treatment and post-treatment. If there's a positive value, it means that they were able to grid hang for a longer time after being given their treatment. And if it was a negative value, it means that they're able to hang for less time after given treatment. So at day 11, we see that there is a significant difference between the FD mice treated with morphine and the FD mice treated with vehicle, where the mice treated with morphine were able to grid hang for a little bit longer than the vehicle-treated mice. However, at day 18, where we see more pathological changes in the FD mice, we don't see any significant changes, but it should be remarked upon that most of the morphine-treated FD mice tend to improve at post-treatment as well. So we also conducted burrowing. Ours is a teensy bit different because we use sand, but this allows for spontaneous engagement and mimics sort of daily activity. So you think about all the things that you like to do during the day. Mice really like to burrow. So we put 500 grams of sand in these inverted tubes. We put them in a cage for 2 hours and we see how much sand they burrow. For the intervention, we tested ibuprofen or vehicle treatment. On the y-axis, we have the amount of sand burrowed, and on the x-axis, we have the study days. As you can see in our male mice, we see this increase in their burrowing behavior throughout the course of the study. But in the FD mice, we see a significant decline at day 6. And although there is a slight increase here at day 13, it's still far below the baseline test. In the female mice, again, we see those control mice treated with ibuprofen and vehicle treatment maintain their burrowing behavior over the course of the study. Our FD mice treated with vehicle demonstrate a significant decline in their burrowing behavior at day 14, and very similar and interestingly, but a little bit frustrating as well, they also tend to improve burrowing after a little bit. So we're still trying to figure out why that is in this model. But more exciting for us, and what is more exciting to share here, is that the FD mice treated with ibuprofen also maintain their burrowing behavior over the course of the study. Finally, we conduct home cage monitoring and wheel running. So we have these amazing cages in a laboratory called digital ventilated cages. This sort of gray plate that's placed under the cages emits this electromagnetic field, allowing for continuous assessment of the home cage activity, which just means how much they move around the cage. But we can also add wheels to our cages, and we can monitor their wheel running behavior. Mice really, really like to run in their wheels as well. And for this, we had 1 male per cage and 2 females per cage, where 1 experimental unit was 1 cage. So here on the y-axis, we took the area under the curve. Mice are most active during the dark hours, so we took the area under the curve for the full 12-hour dark period. In the control females and the control males, they tend to maintain their cage activity over the course of the study. However, in the FD mice, we see the significant decline both at week 1 and week 2 after doxycycline administration. We did a similar assessment for the area under the curve for the wheel running. Again, we see an increase in wheel running behavior in both the female and the male control mice, but in the male in all the FD mice, we see the significant decline in wheel running behavior over the course of the study. So my wonderful colleague, Julie, has made a very nice poster for us